Today we're going to talk about teeth and we're going to talk about hormonal birth control. Dun, 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 dun. Disclaimer, and I will write this down below too, like I'm not a dentist, I'm not a doctor, I know that, you know that. This is just me trying to connect the pieces, trying to make sense out of things that are happening to me personally. And then I learn things and I want to share them with you because maybe some of the same things are affecting you. Let's get started. You may not know, but hormones play a lot in here. Hormones here, they have an effect. Yeah? Okay, good. You know what I'm saying. Okay, hormones, mouth, they play a part in there. Surges in hormones affects your dental health and it can create problems. And this can be anything from puffy, red, swollen, irritated gums to overgrowth of that plaque bacteria that we all know we love, and dry mouth. They don't produce as much of that healthy, necessary saliva. I was told by my dentist the other day, wow, you have good saliva. I've never been told that before, but I took it as a very nice compliment, and it was. And apparently I had an excess of very good saliva. So saliva is apparently good in your mouth, keeps things moving around, keep things healthy, so you want a lot of good saliva. First, let's talk about high levels of progesterone and how it affects your mouth and your smile and all that stuff. If you have high levels of progesterone, it may cause oral mucosal tissue to swell. And what is oral mucosal tissue, may you ask? That is the lining of your mouth. All that stuff, all the skin in your mouth, that's your oral mucosal tissue. So just think of oral tissue, mouth tissue, that stuff. So it may cause it to swell if you have too much progesterone in your body. High levels of progesterone can also stimulate the growth of destructive bad bacteria in your mouth, the stuff you don't want, the stuff that creates more plaque and things that aren't good for your teeth health. Next, it can suppress the immune function in your mouth, which your mouth can't fight things off, can't get rid of the bad bacteria. It's not protecting itself. It can't protect itself if there's too much progesterone. Along those same lines, it can hinder the production of collagen and your mouth's ability to repair itself if something happens. Next, high levels of estrogen may increase the metabolism and the loss of folate. I don't know if I'm pronouncing that right. F-O-L-A-T-E, folate. What is folate? I had to Google it myself, friends. Folate is a B vitamin. One form of folate is called folic acid. We're all kind of familiar with that. And a deficiency of folate can lead to open sores in your mouth or on your tongue. That's not good, so you need your folate. A decrease in bone productive estrogen can lead to osteoporosis, saying that right, in the jaw. And that's not a good thing because you need your jaw. In my research for this, I found a interesting little quote, little statement thing. I don't know if it's a quote, but it says, the oral cavity, aka your mouth, sometimes has been described as a mirror that reflects the health of the individual. So think of your mouth as a mirror. If things aren't going right in here, there's something going wrong in here. And when I'm doing this is the rest of my body. So the hormones not only affect the blood supply to your mouth, but it also affects toxins and your body's ability to fight off those toxins and plaque buildup and all that stuff. Because hormones play such an integral part in your mouth, women are obviously more susceptible to periodontal disease, aka gingivitis. And this isn't a good thing. Gingivitis is not a good thing. So there are different stages in your life where hormones play a part in your body more than normal, and they can affect what's happening in your teeth. We're going to talk about just teeth today. But puberty, obviously, hormones are changing, things are happening, and it can affect your teeth. I'll get into that more. Certain stages of your menstrual cycle, month to month, your hormones are changing, and that can affect your teeth in a bad way or a good way. If women are using birth control pills, we'll talk about that one even more. Obviously during pregnancy, because things are happening in your body, your hormones are changing, you're growing some things. We'll get into that even more. I keep saying that. We're going to go into it even more. All of these. And finally, menopause, because once again, hormones are changing, things are happening, and it affects your teeth. The surge in production of estrogen and progesterone that occurs during puberty can increase the blood flow to the gums and change the way gum tissue reacts to irritants and plaque, and this causes the gum tissue to become red, tender, swollen, and more likely to bleed during brushing and flossing due to hormonal changes, particularly the increase in progesterone that occurs during the menstrual cycle month to month. Folks, thank you. Some women experience oral changes that include bright red swollen gums, kind of the same as puberty, swollen salivary glands, spit, development of canker sores, or bleeding gums. None of this is fun. Menstruation gingivitis usually occurs a day or two before the start of the period and clears up shortly after the period has started. Women who take hormonal birth controls containing higher levels of progesterone, which increase the level of that hormone in the body, may experience inflamed gum tissues due to the body's exaggerated reaction to the toxins produced from plaque. Hormone levels change considerably. Change more during pregnancy. Increased levels of progesterone during this time can cause gum disease at any time during the 2nd to 8th month, and this is called pregnancy gingivitis. I had never heard of this until I was at my dentist, and I asked, have you ever heard of anyone complaining that their birth control is wreaking havoc on their teeth? And she said, no, I haven't heard anyone complain about their birth control. I, however, have just had a child. I have an 8-month-old baby, and there's a thing called pregnancy gingivitis. So I could see, since the hormones are similar, that you could have birth control gingivitis. And so they suggest that you get your teeth cleaned more regularly during your pregnancy. So normally you have like a 6-month cleaning, every 6-month cleaning checkup, that kind of thing. But it suggests like going in every 2 to 3 months to get your teeth cleaned while you're pregnant, because you're more susceptible to gum disease. As we know, when you take birth control, your body thinks it's pregnant. So I talked about pregnancy gingivitis, but it's completely logical and normal to think that since your body thinks it's pregnant while it's on birth control, you could have the same problems with gingivitis and gum disease. Right after I graduated high school is when I got on birth control. So I was about 18, and from the time 18 to 21, maybe 22. I think 22. From 18 to 22 is when I took birth control for 4 years. And my teeth just went down the crapper completely. Like, I've always been I'm not pretty good. I'm good at brushing and flossing. Like, I was diligent about that, but things were happening to my teeth. Like, I was getting cavities, I had a tooth chip, and I'm like, what is happening? Like, it was a very frustrating thing. Like, I still have nightmares that my teeth fall out. And so I was just like, what is happening? And it all really started, I think, my freshman year in college. And that was right when I started, like, I had been on birth control for a couple months on the pill. And that's when one of my back teeth, a molars, chipped when I was eating popcorn at like a comedy show at school. And I went and got that filled, and then it chipped again when I was studying abroad, and I came back and got my teeth looked at, and I had a bunch of cavities, and I was like, this doesn't make any sense. And I said, what could it be from? And my dentist kind of pointed at the fact that I'd just been in Thailand, and changes in diets and eating more rice could have an effect on my teeth, which I think did play a role. But I also think that birth control played a role in my teeth just not being able to combat the plaque and not having enough saliva in there to move everything around. And it's just like a combination of all of it, all of these things that were not good for my teeth. There's all these things that I'm learning now that I don't take birth control anymore, and I'm like, now it makes sense. And I know there's many other factors that play into my dental health, but I just have this feeling that birth control played a part too. And that's why I've shared this video with you. I hope you enjoyed the video, I hope you learned something, and I'll see you next time. Bye guys.